Welcome back to Sawika Sickle Cell Awareness YouTube channel. Today's topic is going to be about asthma. First, let's define what asthma is. Asthma is a lung disease that inflames and narrows the airways, causing wheezing, chest tightness, shortness of breath, and coughing at night or early morning. What's the overview of asthma? Airways are tubes that carry air into and out of your lungs. People with asthma have inflamed airways. They are swollen, very sensitive, and tend to react strongly to some inhaled substances. When airways react, surrounding muscle tightening, airways narrow and lessens airflow into the lungs. Swelling will worsen, make airways even narrower. They are they may be more mucus than normal, causing further narrowing. Well, you want to know what the causes of asthma are. The causes of asthma are unknown. Some genetic and environmental factors may interact to cause asthma, most often early in life, including an inherited tendency to develop allergies, parents with asthma, environmental exposure to allergens, tobacco smoke, or respiratory viral infection during pregnancy, infancy, or early childhood. Now, let's talk about what triggers asthma. Many things can offset or worsen symptoms. Triggers may include, but are not limited to, allergens from dust mite, animal furs, cockroaches, mold, and pollen from trees, grass, and flowers. Cigarette smoke, air pollen, chemicals, or dust in the workplace, and sprays such as hairspray. Aspirin or other non-steroidal anti-inflammatory drugs, and some blood pressure medicines called beta blockers. Sulfite in foods and drinks, colds and other respiratory infections. Physical activity, including exercise, can trigger your asthma. Asthma can be harder to manage due to sinus infection, reflux disease, psychological stress, and sleep apnea. These need to be included as a part of your overall asthma care plan. Let's talk about being diagnosed with asthma. If you have signs and symptoms of asthma, you need to contact your personal care physician and he will recommend you to a specialist. And most specialists are going to look at your lungs and do a lung test. There are different types of tests that they're going to do to determine whether you have asthma or not. Asthma cannot be cured, but it can be controlled by medicines and an asthma care plan. Well, Monica, what should we do next? We want to talk about treatment options and control. Asthma cannot be cured, so there are treatment goals. Prevent chronic, troublesome coughing, shortness of breath, and other symptoms. Reduce the need for quick relief medicines. Help maintain good lung function. Maintain normal activity and sleep through the night. Prevent attacks resulting in you going to the emergency room or long hospital stays. The final thing to do is to know what to do to control your asthma. This is what is recommended, but talk to your physician about your treatment plan. The first thing you need to do is sit down with your physician and you will both come up with a written asthma action plan that you can develop and work with. The next thing you need to do is take the prescribed medicines for your asthma treatment or asthma control. I'm on a rescue inhaler that I use every 4 hours for shortness of breath because I have congestive heart failure. The next thing you can do is avoid the triggers. Early in this video, I talked about what the triggers are. Some triggers but they're not limited to the ones that I've listed. Notice what triggers or starts your asthma attack. Next thing is recognizing and acting promptly to symptoms and signs of your asthma getting worse. Seek medical care for asthma attacks when needed. Don't wait too long. As soon as you feel an attack coming on, seek medical help. Get regular treatments and checkup from your pulmonary critical care physician or your primary care physician or whatever physician that is treating you for asthma. And the final thing is other conditions that may be causing your asthma. Make sure you notate that and talk to your physician about that. Thank you for listening and thank you for tuning in to Sawika Sickle Cell Awareness. Don't forget to subscribe to Sawika Sickle Cell Awareness YouTube channel. Follow me on Facebook at Sawika Sickle Cell Awareness. Also, you can follow me on Instagram and Twitter. Until next time, take care and have a good day.